Everybody deserves the right to have high-quality health care. My name is Joey Resnick. I'm the CEO of Premier Community HealthCare. I've been the CEO for 7 years, and it is an honor and privilege every day to lead our over 250 care team members. Our mission is providing accessible healthcare services to all. We do not turn anybody away based on financial need. We have been serving both Pasco and Hernando County for over 40 years, and we will continue to expand our services and continue to work with our community partners to meet the healthcare needs of all the residents of both counties.
I love community health. I think it's the heart of medicine. It is that feeling of knowing that you will be taken care of if you are ill. It is also having that clinic close to where you live. You always know that there is going to be someone to help you. I think when you think of accessible healthcare, you have to think of community health centers. That is what we are for.
I wanted to find a really good provider that had multiple locations because I'm always the one that needs to get to the dentist and I don't want to wait 8 months to take care of my dental health. And for my son who is special needs, he's autistic, I like the Kidscape program. It's like a family wellness program that was able to help me talk about his dietary needs.
Currently, we have 13 physical locations throughout Pasco and Hernando County and 2 mobile dental units. And our service lines include adult and pediatric medical, adult and pediatric dental, adult and pediatric behavioral health, as well as a full line of women's services. In 2021, we did open up our first location that is dedicated to pediatrics, and we offer medical and dental services at this location.
When I started at Premier 8+ years ago, my number one goal was what can I do and what kind of contributions can I make to my community? And Premier is the vehicle that allows me to do that.
What also makes us different is that we offer community services. You do not have to be a patient here to make an appointment with our community service care team members.
Community services provides a lot of different resources. There is no payment involved. It's completely free.
I do medical assistance for adults and children, food, housing, a little bit of everything.
If I was not able to get a ride to the appointment, I was able to call, let them know of the distance to the appointment, how many miles that was, and they actually reimbursed me. That was it for me. That really showed the difference between your regular primary care and dealing with Premier Community Health Care.
I did have a patient come in, and that one hits hard. She was desperate. Literally, she was desperate. It was her grandson. She had no idea what she was gonna do. She didn't want him to go without his medication because his mom didn't want him. I said, there's no guarantee. I don't know what I can do, but I do my best. He was approved for Medicaid. We both cried. It's just something you can't explain. You know what I'm saying? It's just, I was floating. I was literally floating.
Community services is truly the connector. We're the ones that are with the community, whether it's at events, Men's Health Clinic Day, Women's Health Clinic Day, Children's Dental Day, the MSAW Dental Day. When we have these events, we're able to make new Premier patients because they realize all the great resources that are offered here.
If you need help with anything, housing, food, employment, just call. We have multiple locations, Dade Cities, at Rails, everywhere. Just call.
What we do is ensure that our patients get the very best in care, to get them into our health center and ensure that they get the care that they need. I was working for GI surgery, colorectal cancer to be specific, and I encountered a patient who had a colon cancer. If the patient would have had a colonoscopy or had access to healthcare services, we could have prevented him from having to have this aggressive surgery. But he was uninsured. I don't think any patient should have a poor health outcome simply because they're uninsured, or because they don't have the money to pay for services, or because they don't have the educational status to ask the right questions.
Just in Pasco County alone, we have almost a third of our population that are at or below 200% of the federal poverty level. You might be wondering, well, what is that? I have no idea what that is. Well, let's just look at 100% of the federal poverty level. That's about $12,500. I've got to pay rent, I've got to make sure I got transportation, and I have to make sure that I'm eating. And so where does healthcare fall into that?
I had a bolus, I had an obstruction in my esophagus. I needed follow-up care after I got out of the hospital. and I was like really, all the doors were pretty much shut because I didn't have insurance. You get released out of the hospital and they say, you have to go see your doctor. I don't have a doctor, man. What do I do? The administrative people at the hospital at Trinity said, call Premier. I made my appointment. I saw my healthcare professional, Therese Christmas. She was in there with me probably 45 minutes, and listening to all my concerns. So it's like, it was like, I'm not kidding, it was like this big weight just taken off my back. I was so grateful.
We really want to make sure that we're providing that extra safety net, which is what our fundraising dollars allow us to do.
So the first time I heard about COVID, I thought we would be hit hardest with our patient population that we see. And, I thought to myself, we'll have to brace ourselves as providers, but also as just people living in our communities. How do we approach this? What are we going to do?
It was a mystery. It was very serious. It was an unknown. It was something we'd never seen before.
It is now Community Health Center's time to jump into action. It was going to be our time to do all that we can to educate patients on what COVID was, what it meant to them individually, what it meant to our community, and then to aggressively start putting action plans in place to prevent individuals from contracting COVID and from ending up in the hospital.
For me, most importantly, is that we did not have to let go and reduce our workforce and reduce any of our care team members.
We have learned so much about ourselves and our community that we serve and what we can do in times of trial.
It brought us closer together as a work team, as a care team.
When we finally made the decision to do testing, we didn't have access to the supplies, masks were short.
We started thinking, oh my goodness, can we do this? And within days we were having drive-through, and it was a success as far as getting community testing going.
We implemented telehealth within the first 2 weeks of COVID. This was important so we could still provide services to our patients that couldn't come to the office or did not feel comfortable coming into our sites.
We went from thinking we would perhaps do telehealth in 2 years to having telehealth in a few weeks. And then when the vaccines came, that was also another good thing, that we were able to go out into the community, and which we still do, to get folks vaccinated, and even having drive-through vaccines here at Premier Community Health.
I know we've had a lot of negativity about COVID, but what it allowed us to also do was broaden our horizons and to think outside of the box.
At the end of the day, we are extremely proud that our doors never shut. The biggest misunderstanding is that we only serve a certain population, and the reality is that we serve everyone that walks through our doors.
I drive over 40 miles to come here, past several other dentists that I could go to, and I have insurance. Cost isn't a factor.
It's about an hour ride, but I heard such wonderful things about Dr. Harper that I said, okay, we'll take a ride and come out and see Dr. Harper.
It's excellent care and just top of the line everything.
The way I see it is we provide the absolute best care possible for the least amount of cost. And it is something that I am proud of, to be able to have other dentists come in and look at what we do and say, I can't believe you guys provide that kind of care for that kind of cost.
I love the population, I love the patients, I love the collaborative atmosphere of medical and behavioral health and dental and women's health and all the different services that we provide.
Having a community health center helps with bridging the gap for us. Looking for a place where they can go in and just have a one-stop. We provide that referral to our clients all the time. It's vital for the community.
My entire family is patient of Premier. My husband, my 3 kids, my in-laws. I do recommend it. We do provide great services.
We believe in the mission, we believe in the care, and we provide that care every day to our patients. It warms your heart to work here at Premier.
Every opportunity to support Premier is right here.
One of those opportunities is our board of directors. 51% of our board members are patients here at Premier, or their family members are patients here at Premier.
We also have 2 advisory councils, one that is based on the west side of our communities that we serve, and one that is based on the east and central side. Anyone can get involved, and this allows you to have a voice at the table. We accept donations throughout the year via our website. Every dollar that is given to Premier in turn supports our mission. And at the core of that mission are patients, your neighbors, my neighbors, people throughout our community. Building our awareness takes all of us. It's not a billboard, it's not a bus bench. It's you having a great experience and you telling a friend or a family member or a coworker that you can get high quality services from a compassionate care team at Premier Community HealthCare.